What comes to your mind when I say the word obesity? Giant burgers, supersized soft drinks, a fast food place? But here in Pakistan, the word we're far more familiar with is diabetes, because we all know someone living with it. According to the International Diabetes Federation, over 34 million adults in Pakistan are living with diabetes, the fourth highest number in the world. But experts say we're only fighting half the battle because we're trying to manage diabetes without fully addressing its biggest driver, that is obesity. For years, obesity has been misunderstood. It's been seen as a lack of self-control or a lifestyle problem, something to hide or mock. But science and global medical consensus say something very different. Obesity is a disease. Professor Wasim Hanif, who is a professor of diabetes and endocrinology at the University Hospital Birmingham in the UK, says that over 100 million people in Pakistan are obese. Obesity is a disease, he says, and its main symptom is hunger. That hunger and the environment around it shapes our health outcomes. But here's another fascinating finding. A growing body of research says that South Asians may be biologically more prone to obesity and diabetes. Why? According to Dr. Mubin Said, during the colonial era, repeated famines reshaped how our bodies store and use energy. Scientists call this starvation adaptation, the ability to store fat quickly and burn calories slowly as a survival mechanism. This helped our ancestors survive scarcity. But in today's world of calorie-dense food and reduced physical activity, this adaptation increases our risk of rapid weight gain, insulin resistance. It also increases the risk of heart disease and metabolic disorders. In short, we inherited a survival response, but the world around us changed. Over recent decades, Western-style fast food, ultra-processed snacks, sugary drinks, and fried convenience foods have reshaped eating habits even in Pakistan. But unlike Western countries, which later introduced regulations, soda taxes, labeling laws, school meal reforms, Pakistan inherited the risks without the protections. But that is changing. Despite the challenges, Pakistan has begun taking meaningful action to support public health. We've passed new national standards limiting industrial trans fats in foods to below 2%. This reduces heart disease risk and encourages healthier production practices. And then the 2021 to 2030 National Action Framework for Non-Communicable Diseases is a long-term government strategy to A. strengthen prevention, B. promote healthy eating, C. improve screening, and D. integrate obesity care into primary health services. But the most important action is to start treating obesity as a disease and not a personal failure. This will lead to earlier diagnosis before complications develop, less stigma so that people start seeking help without fear or shame of obesity, and also better healthcare, as in primary clinics can offer structured weight management plans and dietary counseling. And then it will also lower national health costs. By preventing obesity early, we reduce diabetes, heart disease, kidney failure, amputations, and hospital admissions. And international research confirms all of this. Structured lifestyle programs such as the Diabetes Prevention Program have been shown to reduce the risk of developing type 2 diabetes by 58%, often outperforming early medications. But lifestyle is just one part of the growing toolkit. Experts highlight that for people with more severe obesity or long-standing diabetes, modern medical science offers powerful additional options. Bariatric surgery, for example, has reversed type 2 diabetes in a significant percentage of patients, demonstrating how closely gut hormones and body fat levels are linked. And in recent years, a new class of medications, GLP-1 therapies, has transformed obesity treatment globally. But more importantly, this innovation is already reaching Pakistan. A study conducted at the Aga Khan University found that semaglutide, a GLP-1 medication, was effective in reducing body weight among Pakistani patients with type 2 diabetes. So, lifestyle changes, medical therapy, and surgical options give Pakistan a full spectrum of tools to tackle obesity and prevent diabetes before it becomes life-threatening. But for that, it's important for us to recognize obesity and treat it as a disease first. This will not only transform health, but also lower health costs, increase productivity, and decrease burden on caregivers.